I remember my mom said she got a text that we weren't gonna be able, that we were out of school for 2 months. So I was just shocked because we're actually out of school. And at that time, I was wondering, well, why are we out of school so long? It's not even summer break. We don't have summer break for even that long.
COVID-19 had an immediate impact on our community. When March hit, we ended up having to shelter in place immediately. And we have an after-school component to our agency. And so children were not able to go to school. Parents started getting laid off work. Food insecurity started happening. So we immediately jumped into gear.
Our client is elderly and also they have very limited English. And since the COVID start, most of all government benefit office is closed. So for them to have access for any benefit like food stamp or CalFresh food stamp or Medicare, it's very hard for them. They cannot go, and also sometimes they cannot find anybody to translate for them.
It's a really difficult situation to find ourselves in, and nobody wants to, continue to marginalize our community, especially the Latino community, our largely undocumented community here in Roseland. But when it comes to the health and safety of the greater community, we have to have a very culturally relevant, empathetic, compassionate approach.
As it progressed during each month, the anxiety began to get higher to the point of, oh my goodness, this is a worldwide effect, but it was also so internally that there was confusion. That's when the places started to close down and our community started to become isolated even more so. And there was a lot of folks that then began to have their fears grow even rapidly, even faster. And then also our community began to also become depressed because folks were losing their jobs. Folks were then being stuck within this, often small dwelling with multiple generations in it. And it really caused a lot of stress.
As a young person who is not out at home, so when they join our meetings, they are only able to type into the chat. I know there are so many others out there who aren't even in a space where they're able to show up at all. Because of what their home life is like. And we can't fix that problem on our own. This is a community issue. So we do what we can.
We all work in this field for a reason, and we want to help our community, and we see community first. So I think just keeping going and doing the best we can, to provide the best quality service.
We don't believe in piloting. We're not trying to pilot a project and then close it down and then start another pilot project. We're trying to take the solutions that work to scale. And that includes the community-defined evidence-based practices that is part of the CRDP, but even more broadly. I mean, it's not that we don't have the solutions. We don't have the resources that we need to take the solutions to scale. That's where we need the support. And that's where the funders and the policymakers can come in. Communities of color, we know what we need. It's not a question of trying to find out what we need, collecting more data to demonstrate that the need is here. Those are not the questions. The question is, who's going to fund the solutions that work?